Seizing the Day, a look into the life of a woman living with epilepsy. So what is epilepsy? Epilepsy is a neurological condition which is characterized by recurrent seizures. Seizures are disturbances in the electrical functions of the brain, and epilepsy can affect people of all ages and both genders, and it can be due to many causes, some of which are unknown and some of which have a genetic basis or are caused by neurological infections or head injuries. The solution to epilepsy, according to the medical community, is to take anti-epileptic drugs, and 70% of patients affected by epilepsy can have normal lives. For this project, I interviewed my sister, Roberta di Rocco. She was diagnosed with primary generalized epilepsy at the age of 23 after being misdiagnosed since childhood. She passed out in a mall dressing room, and she practically diagnosed herself during a Google search. What can be done to treat epilepsy? This type of epilepsy, primary generalized epilepsy, responds very well to a medication that is called Depakote, which is valproic acid. And this medication, however, is very strong, and so it's very dangerous for a developing fetus. It's actually called an X category, which means that it has been shown to cause birth defects. So for this reason, when a man is diagnosed with this type of epilepsy, they are immediately given Depakote. However, women have to wait to either not be in their reproductive years any longer, or they have to prove without a doubt that they are not willing to have kids and they are on a very safe form of birth control. When Roberta was diagnosed, she was too young to be put on Depakote, and she had to wait 10 years before they would prescribe Depakote to her because of the risk of being pregnant being too high. And those were the toughest years of her life, because the medication that she was put on instead, which was called Lamictal, was actually not controlling her seizures well enough, which limited her ability to do her everyday activities. The side effects of anti-epileptic medications, especially for one like Depakote, which is one of the strongest ones, are what makes dealing with epilepsy so hard. Some of these include weight gain, hair loss, memory impairment, nausea, blurry vision, and hand tremors. Now, I asked Roberta, what does epilepsy do to you as a person, emotionally and physically? And Roberta states that emotionally, her diagnosis was particularly difficult. She became very insecure as a woman and as a mother. She feared having a seizure while taking a shower or while holding her, at the time, 2-year-old baby. Physically, she became very weak and tired after starting her medications. She had to take several naps during the day. She did not sleep as well at night. Life as a mother became suddenly harder, and it became also very difficult as a woman because the side effect caused her sense of femininity and good looks to fade, at least temporarily. She also did not feel very supported by her loved ones, but rather judged, because she needed help to take care of her baby and even of herself sometimes. And seizures are not always visible, especially her type of seizures. Therefore, people did not always understand her struggle and sometimes called her lazy or told her that she was faking it. She initially felt judged by people for not being able to be the strong, hardworking mother that they thought she was supposed to be. People tend to assume you're fine just because sometimes these seizures can be very small and people around you might not even realize that you're having them. However, they can leave you drained. and tired. And also, her being an Italian woman increased the pressure and the disappointment in people because they always thought she was supposed to be beautiful and strong and productive and the perfect housewife. And she could not be that for at least a couple years after her diagnosis. Roberta struggled the most with weight gain and hair loss as far as the side effects from the medication. Within a 6 month period, she gained 30 pounds and lost about 70% of her hair. This shook her in her confidence as a woman, as she was socialized to always believe that she needed to look her best. However, later she feels lucky enough to be able to cut the medication dosage in half, and after following a ketogenic diet, which is a diet that is based on high consumption of fats and low consumption of carbs, she was able to lose the weight and she was able to grow her hair back within 2 years. What she believes that should be done in an ideal world for women with epilepsy would be to receive, first of all, the emotional support of her family and her friends, possibly also to receive a disability check to help pay for maybe hiring help for themselves or their kids. Mental health is definitely important because once you receive your diagnosis, you may go through a depression or a period of anxiety. And also, it would definitely help to not be stigmatized by society's expected gender roles. What I learned through this interview is that everything seems to be harder for women, especially once you have a medical condition. Because with her story, I learned that as a woman with epilepsy, you might have to choose between becoming pregnant and getting the right treatment for yourself. So that means that you have to choose between your own health or having kids, and that it would be hard for me.